Hello friends, welcome to my new video. So today in this video, I'm going to show you a live demonstration how to perform cover test so that it will be very easy for us to understand the type of strabismus. Okay, so before going to that discussion, first of all, we need to know that what is cover test. So cover test is the procedure where if the person is having a strabismus or squint in his eyes, that means his eyes is deviate, it can be inward, outward, upward, downward, and suppose other eye is normal looking eye and one eye is squinty. So when the examiner block one eye, that is normal looking eye, that means the examiner is blocking the fixation, then the deviate eye will try to fixate to allow or to make the image fall on the macula properly to see the thing better. Okay, so this is cover test. So how it is performed today we are going to discuss, and how it is treated or the management part we will discuss in the next video. Okay, so let's start. So first of all, this is cover test. After that we will go to cover uncover test. So here the person is having left eye exotropia. Okay, so here we need to perform cover test. Okay, so in cover test, occluder is placed over the normal looking eye and the deviate eye will do fixate, okay, to allow the image or to form on the macula. So this is cover test. So if the eye is isotropic, then after covering the normal looking eye, the deviate eye will move outward, okay, to take fixation. And if the eye is exotropic, as we see in this example, that the person is this person is having left eye exotropia, but after covering the normal looking eye, that exotropic eye turned nasally or inward to take fixation. Okay, so this is cover test. So here the normal eye is occluded and examiner will observe the movement of the uncovered eye. Okay, now this is cover uncover test. Okay, so here in this test is performed to understand or to find out the presence of phoria. So in cover test we find out the presence of manifest squint. Okay, but in cover uncover test we find out the presence of latent squint. Okay, so here how it is performed. So the person is apparently it seem to be a normal person where there is no deviation is noted. Okay, so we need to perform cover uncover test to find out any type of strabismus present in this patient or not. Okay, so we're occluding one eye, and if the eye which is under cover, if it is if there is presence of any strabismus, then when the fixation is lost, then the eye will turn outward or inward depending on the type of strabismus patient present in that patient. Okay, so in this case we seen that. Okay, again I am showing you after placing the occluder in her right eye, we can see that the eye is deviating outward, that is exo, so it is exophoria. Okay, so this is how it is determined. So after placing the occluder we will remove it, and if we notice that the eye is moving towards inward, because when the occluder is placed over that eye is deviate outward, and when the occluder is again removed, then the deviate eye will try to fixate again, so it will need to move inward if it is exophoria. Okay, so this is how, depending on the direction of the movement of the eye, we can determine the type of strabismus. Okay, so it is a case of exophoria. Now after removing the occluder to the other eye, we can see that this eye is taking fixation, that is moving inward. Okay, so it's a case of exophoria. Now we are going to alternate cover test. So alternate cover test is performed. Oh, another thing I need to mention is that in cover uncover test we check the movement of the eye which is under cover, and in cover test we examine the movement of the uncovered eye, but in cover uncover test we examine the movement of eye under cover. Okay, now in alternate cover test how it is performed. So the person is having left eye exotropia. Okay, so when the occluder is placed over the normal eye, then her left eye is taking fixation. So after some second we will move this occluder to the other eye, okay, and we will observe the movement of the eye which was under cover previously, okay. So we notice that after placing the occluder in her right eye, her left eye which was previously having exotropia take fixation, but the eye which is under cover deviate outward due to absence of fixation, okay. So after removing the occluder, or after moving the occluder to the other eye, the eye which was under cover is again taking fixation. So by noticing this type of behavior or this type of movement in the both eye, we can assess that strabismus or squint is present in both eye. That is also known as alternate strabismus or alternate squint. So that's all friends. Thanks for watching. Please don't forget to like my video and subscribe to my channel. Thank you so much.